Good evening and welcome to All the Facts with Dr. TJ Mohale. It's just gone 22 hours 42 Central African time. That is around 16 hours 42 Pacific time. I mention Pacific time because we are patiently waiting for the White House, the daily White House coronavirus task force briefing. The reason I'm mentioning that is because we heard from yesterday's briefing that the United States, the largest funder of the World Health Organization, will be halting funding to the WHO. So that is a very interesting topic that we must keep a close eye to. So today I will not be having any guests, and in today's topic I just want to go through what we call public servants. You see, public servants. I want to mention a few things about the public wage bill. I will also talk a little bit about what the Solidarity Fund. The Solidarity Fund. They are calling it the fund. So, why are we talking about public servants and why are we talking about public wage bill? Today is the 15th of April 2020. Public servants were expecting their salaries to go up. Why? Because that is the agreement. That is the agreement that unions and public representatives of workers in different sectors of the public service machinery agreed on in 2017. The government is the one that pleaded for a multi-year agreement. In that multi-year agreement, they agreed on a yearly agreement for 3 cycles, 3 years, 3 financial years. In that agreement, the public servants expect their salaries to go up by the inflation rate with a little bit on top. If I remember correctly, those in the higher categories from level 12 to level 16 on the government wage scales were only going to receive about 0.5% on top of the inflation rate. Those in the lower categories from any level below 11 were expecting inflation rate plus around 1% upmark in their salaries. The government was not forthcoming as to whether they will be increasing or if they will not be increasing. So people were essentially waiting for the first group of those who get paid on the 15th to see if there will be any increase. There was none. Today, the largest federation of unions in South Africa, COSATU, said that they will be following an internal process. Remember that they can easily go to court and say, look, we have an agreement with the government. The government is pulling back from this agreement, and the court can decide. But COSATU has decided to follow an internal process. We don't know how long that is going to be and what the results will be. In the meantime, people continue working. So let's address this issue of saying the public wage bill is bloated. There is this issue that the public wage bill is bloated. I don't know if it is. So let's just break it down a little bit. Let's just break it down a little bit to. So in the public service, in the public service, you have what? You have education, you have health. These are the two big components in the public health. In the public service. There are others, there are others. You can add many others, Education, you have SATU there. Health, you have NHAU and others, the NOSA and other unions representing health. Those are the unions representing health. Education and health. I just want to use these two big ones as an example. We can add more, but I just want to use education and health as an example. So when you build, what does education do? Education provides education to the public. You have public schools. Let's leave private schools for a moment. You have the public schools. Their mandate is to teach the public. So the core business of education is teaching. So you will have teachers. So when you build a school, you know how many teachers each school need. Let's call that number X. Whether it's a high school, whether it's a primary school, when you build a school, you know how many teachers that school need. Therefore, you can have a total number of teachers that you need, say in a district, you can add them, say in a province. So at any given time, the Department of Education knows how many schools they have, how many teachers they need, and how many teachers are actually there. That will be the number X, the number of teachers that you need from the beginning. That is called the staff establishment. You can't build a school and not know how many teachers will be needed to run the core business of that institution called a school. The same is true in health. When you build a clinic, you know how many nurses that clinic need to be able to operate. That is called staff establishment. Now let's just, your kids go to school, you have been to a health institution. Would you say our clinics have the nurses that they need to be operating? Does our school have the teachers they need to be operating? Or are we just making do with what we have? If you follow the statistics, a few years ago, they were telling us that South Africa is missing about more than 100,000 nurses in the public sector. They added these numbers by simply looking at the staff establishment. You combine all your clinics, you combine all your hospitals and say, we should be having 500,000 nurses. And by the look of numbers, we're only having around 400,000. Therefore, you are missing 100,000 nurses. The same can be done for schools. You can look at how many teachers are there working in a school and compare it with the staff establishment and see how many teachers you are missing in our public schools. So the second point there we must ask ourselves is, are our public servants being paid what they deserve? Are teachers in public earning anything comparable to teachers working in private schools? I will not compare with other countries. I'll just keep it here locally. Are you saying that our police are being paid what they deserve? Are they being paid the market price? So the basic salaries of our public servants, is it market rated? Is it what they deserve? Or are people being paid what the government can afford? That is debatable. But if you compare, for example, nurses working in public hospitals and clinics versus nurses working in a private institution, there is definitely a big salary gap there. That is why people leave the public sector. That is one of the reasons why people leave the private sector and go work in the public sector. I mean, in the private sector, the salary differences. So I have explained about staff levels. I have explained about the market salaries. So the question we need to ask when we are being told that the public wage bill is bloated, we must ask how. Is it bloated because we have enough of the people that we need to be executing the core business of each public office? Are we saying that South Africa has employed enough police for each police station that we have in the country? Police are public servants. They are represented by Pop Crew. Prison warders. Do our prisons have enough warders? What are the staff levels in our prison warders? What are their salaries? Are their salaries market related? So I will talk about what I can talk about. You know, I work in health, so I will keep using health as an example. So we need to analyze. I keep on mentioning the word core business. If you are a school, your core business is teaching. So you need teachers, but you also need support staff. So you need managers at different levels. So we need to break it down and say, how much do the manager's salary contribute to the wage bill? And how much do the core workers, I'll call the core business, core workers, and ask you a hypothetical question. If you needed to make a cut, where would you make a cut? If you have a clinic and you are in health and you want to reduce the cost, would you be reducing the nurses who are conducting the core business of that department? Or would you be looking at restructuring the entire department? Over the past 20 years, the structures of all departments have changed. There are too many managers. There are managers of everything. So we need to have those numbers before we complicate this matter any further. I have explained about core business of just education and health. Can you fire people working in a hospital saying you want to save the wage bill? Can you fire teachers in school and say the government cannot afford teachers? Can we afford to fire prison warders and say, well, we can't afford to have prison warders? Is that practical? So we need to look at that. So right now the government is saying all public servants will not be getting their salary adjustments. Remember, the inflation has gone up. So if you tell someone that your salary will not be increased even by the inflation rate, you are essentially asking that person to take a pay cut. So unfortunately, we can only compare with history. What happens every time the government says to the public servants, we are not going to increase your salary, we are not going to give you your bonuses, we are not going to do this? There's always a strike. We are in the middle of a pandemic, so I hope there is no strike. I hope COSATU is able to resolve this issue. I hope the courts are able to intervene, because the agreement that the public servants are talking about is in black and white. It was agreed in 2017, so this should not be a long debate. You know, the government must hold up their end of the deal. Otherwise, they are risking putting a lot of people at risk. You know, they are putting a lot of people at risk. So that's all I want to say about the public servants, the staff establishments, and the wage bill. So I don't think the wage bill is bloated because we have the people we need. So we must review the public servants structure. in total. So let's just go ahead and talk about the Solidarity Fund. So when the president announced the declaration of the state of disaster, he spoke about the Solidarity Bill. So, the Solidarity Fund, sorry. So the Solidarity Fund is a fund that was created to help South Africans who are in distress, people who are losing their jobs in this time of crisis of the COVID-19 pandemic. The state offered a seed capital of 150 million. The president proudly announced that 2 rich families will each be pledging 1 billion each. There's been conflicting reports. Is it a loan? Is it a donation? We don't know what it is. And the president has not clarified that thoroughly to us. I would like to ask anyone in the small business sectors if they have received any assistance from the government. We know in some countries there are delays, but the UIF has clarified that not everyone qualifies for UIF, for example. They have clarified that the UIF is an unemployed insurance fund. So for an insurance, you actually have to pay while you are working so that you can qualify for that. So with the prospect looming of an extended lockdown, remember everyone was excited. Tomorrow is day 21. We were looking forward to the lockdown being lifted, but it's extended by a further 2 weeks. So with the prospect of a prolonged lockdown, the Solidarity Fund will have to take care of a lot of people. So we don't know how many people so far the Solidarity Fund has helped. There have been a lot of talk about the Solidarity Fund. For example, the Motsepe family spoke about buying PPEs, buying masks, and buying supplies for hospitals. Unfortunately, until we can see those supplies, it's been 2 weeks now since the more than 2 weeks since the Solidarity Fund was established. So I don't know who is monitoring the fruits. I don't know who has gotten any help from the Solidarity Fund, but I just wanted to mention it because today the Department of Public Service Administration has sent out a circular which is asking for all public servants to voluntarily opt into donating into the Solidarity Fund. Unfortunately, I find that circular to be very absurd. The government is already not increasing public servant salaries. We are already being asked to take a pay cut. Somehow the government still think that on the same day that they ask us to take a pay cut, they are asking people to donate. It doesn't make sense. It's conflicting. I said yesterday that please take care of your extended families. Now, can you imagine how many extended families each one of us has to take care of, who have lost? Most of our people are working in the informal sectors. So everyone has an extended family to take care of. So I think the government should go and ask that money from these companies which has increased the price of everything. I have asked you with business degrees, when is the price of food going down? The price of Brent crude, Brent crude, I'm not an economist, but every time they increase the price of food and the cost of living, they're saying oil is expensive. Well, no one needs oil now. No one is driving anywhere. So when is the price of food going down so that we can afford a little bit, especially when they're asking you to take a pay cut and also asking you to donate? So we are yet to see the true fruits of the Solidarity Fund. But I find it upset that the same government that is asking public servants. For me, a lot of public servants are already fighting COVID-19 with their lives. If you have to wake up every morning and go to work, in my book, you are already doing enough. You are putting your life on the line for your country, a country that I believe you love. Otherwise, a lot of people have taken leaves. It's not every public servant who's at work. Some of our colleagues have taken leave. So everyone who wakes up and go to work, whether you are a policeman, whether you are working at the shop that is selling food to the public, you have done enough. You have done your part. Unfortunately, you cannot ask the public to donate to the Solidarity Fund. People are not working. So the question is our country broke? I don't know much about the fiscals and the country's debt, but are we broke? I look at the United States of America. Of course, they have money. They can throw money. That is why Congress has passed a 2.2 trillion US dollar bill. That is about 44 trillion rands, you know. So I don't know. It sounds like the country is broke, which begs the question, has the country not been saving money? They're always giving us financial assistance. Save for the rainy day. Save for the rainy day. But it looks like the country does not have any money. If they are asking people to donate to fight a pandemic, it looks like the country is broke. So maybe the Minister of Finance might be a good time to explain to us if we have money to actually fight this COVID-19. I said police are risking their life in the streets to enforce the law. They are not immune to COVID-19. Nurses in hospitals, the security at the gate of the hospital, they are risking their lives every day. You cannot be asking people to donate. You should be doing what other countries are doing, but it looks like the country cannot afford the fight against COVID-19. You see, America is giving their people checks of $1,200. Britain has given people checks of £2,500. Electricity is free in some countries. In South Africa, we have bills to pay. So I don't know where we are supposed to get money to donate to the government. We pay tax. So for me to ask the public to donate to the fund, public servants to donate to the Solidarity Fund, it feels like a second form of taxation. We are already willing to lay our lives in the fight against COVID-19. That is why in hospitals, we see patients, even if we don't have the optimal personal protection equipment that the government must supply. There's been funny things on social media. The public is trying to sell healthcare workers and frontline workers masks and PPEs. First of all, I don't know where they made those masks, but it is absurd for the public to try and sell us PPE equipments. Donate them. If you are a construction company and you have masks, donate them to the people who are fighting COVID-19. You will buy them when construction reopens. So that is all I just wanted to say for tonight. Hopefully in the next few days, I can find a business colleague who can go into details about the economic impacts of COVID-19. We are being told that the trials that are going on with vaccines are not going very well. That means we are definitely going to wait for close to a year at least. That is 2021. It's April now. So there will not be, most likely will not be a vaccine available in the next few months. That means life will change. The government can afford more than R1 billion to deploy the army on the streets. But when it comes to giving people food, they want people who are on the front lines of fighting the virus to donate. So life will not be the same until we find a vaccine. That is unfortunately the hard truth. Herd immunity, I do not advocate for herd immunity without a vaccine because that results in a loss of life. So the only message I leave you with tonight is our government ready to fight COVID-19? Because this is a financial battle. You need money to fight the virus. So the question is, what are the provisions? What are the financial provisions? Every day we are seeing press conferences about donations made by so and so. Today we saw two soccer legends, Chinchagolova Kaizer Motaung, owner of Kaizer Chiefs, and also the Iron Duke from Orlando Pirates, Dr. Ivan Khoza. They were donating hundreds of thousands of masks. That's good. They have money. People have been supporting their teams. They have been supporting their teams since a long time. We have been going, the derby is always full. So we thank the two kings of South African soccer for their part in fighting COVID-19. So for me, businesses must donate because we, the people of South Africa, have been supporting their businesses. Secondly, if private businesses do not support us and we all die from COVID-19, they will not have business. So we have been supporting big businesses since forever. Since they are in business, we keep them in business. So big businesses must come to the fore. You cannot expect a person working, going to work, risking their life you cannot expect somebody to fight COVID-19 with their life and with money too. So I am not even going to go into the hazard pay. I took an oath as a doctor, but I never took an oath to fight a pandemic. I'm fighting it because I'm here. And when a war comes into your backyard, you don't run away. But the government does not want to talk about hazard pay. People are putting their lives in danger to fight this virus, but the government does not want to entertain the concept of hazard pay. They are saying if you contract COVID-19 while on duty, or if you die, they will compensate you. Why do you want to compensate somebody when they are dead? Compensate them now when they are still alive. Buy them PPE now. Show that you care by giving them what they need to reduce their risk. Don't tell us that you will wait until they are dead and compensate their family. Old Mutual started a so-called 4 billion rand life cover for free for healthcare workers for 10,000 rands. That is good, but I don't necessarily agree. Why does Old Mutual have to wait for somebody to die to compensate them? If Old Mutual really cares about healthcare workers fighting on the front lines, they should pledge real money, not life cover that will kick in when they should pledge in real money and buy these healthcare workers that they claim to care about PPEs so that no one dies. I'm not saying PPE is 100% protective, but we all agree that it is necessary. The Constitution makes provision about health and safety protocols on duty. So, yes, they have announced a 4 billion package for life cover, but that is not really real money. You need to die first before they pay out 10,000. I don't wish anyone dies from COVID-19 while fighting on the front lines. I wish we can stop the ever-rising death toll of COVID-19. I just checked, it is climbing above 98,000 worldwide. So that's a lot of deaths from COVID-19. So please do not promise us life covers if we die of COVID-19. Assist the government to do better in getting us the PPE that we need to protect ourselves. Please wash your hands, sanitize when you are on the move, Remember, you cannot sanitize your hands the whole day. You must wash them. Wear a cloth mask when you go to the shops. Respect the 1 meter regulation, that the 1 meter distance between individuals, physical distancing, and only go outside when necessary. Continue praying for frontline workers. Continue assisting your extended families and families in need. And let's hope and fight. We cannot only hope, we must fight. So for those of you who are able to contribute to the Solidarity Fund, please do. Please do. But I still believe that you cannot fight a pandemic with handouts. This is war. And to fight a war, you need money. So the government must really step up their efforts of fighting this war. Wash your hands, please, and stay at home. Good night.